How to care for a child with malnutrition. Your assessment of a child's signs and symptoms will help you decide how to care for a child with malnutrition. This video will focus on when and how to treat the child at home or refer them to a health facility. For more detail on how to do the assessment, refer to another video in this module. Remember that the illness can change over time, and a child may get worse quickly. So, reassess the child in a follow-up visit and educate the family on the danger signs to look out for. Let's explore when malnutrition can be a sign of a mild, moderate, or severe illness. Malnutrition can be a sign of a mild illness if the child measures between 12.5 and 13.4 centimeters on the mid-upper arm circumference, or MOAC tape, which is close to the yellow, or shows a single measurement below their normal growth curve. In both of these cases, the child should show no danger signs and have access to nutrient-rich foods. Explain to the caregiver how to care for the child at home by counseling them on good feeding. Undernourished children need food which is high in vitamins, nutrients, and energy. Suggest that the caregiver mixes the child's food with oils and food sources high in minerals and vitamins. For example, porridge with peanut butter, samp with beans and margarine, or meals with vegetables mixed into them. Adding a teaspoon of oil or margarine to the food is a good way of increasing the energy content of the food. Malnourished children also need to be fed smaller meals more often. Ask to see the child again in a few days to follow up, or sooner if the child gets sicker. Explain what danger signs the caregiver should look for and that they mean that the child needs to go to a health facility immediately. Let's look at when malnutrition is a sign of a moderate illness. A child has a moderate illness if they have a yellow reading on the MOAC tape, or between 11.5 and 12.4 centimeters, and they are not living with HIV. A child also has a moderate illness if they have a few measurements over time which indicate they are falling off their growth curve. If the child has these signs, it is important to assess the child for tuberculosis or HIV. Ask the caregiver to take the child as soon as possible to a health facility for testing or treatment. If you can, refer the child to a community-based or supplementary feeding program. Counsel the caregiver on nutritious feeding practices, and explain that a child with a chronic illness often needs to take in more calories. Helping a child recover from malnutrition, whether it is mild or moderate, may take time. Support the family through this process and encourage them to be patient as they increase the nutritional intake the child receives. It is also important to protect the child from getting new illnesses which can make malnutrition worse. This includes protecting the child from playing in dirty areas and encouraging them to wash their hands often to prevent recurring diarrheal and respiratory infections. They should also prevent the child from being exposed to cold or wetness, as this can increase their metabolic demand or the calories their body needs to take in to function well. If the child receives additional care and does not show any signs of recovery, the malnutrition may be due to an underlying cause, such as tuberculosis or HIV. Educate the caregiver on the danger signs to look for and make sure to follow up with the child. Malnutrition can also be a sign of a severe illness. If the child has any of these signs or symptoms, they have a severe illness. Red on the MOAC tape, which is a measurement of less than 11.5 centimeters. Yellow on the MOAC tape, which is a measurement of between 11.5 and 12.4 centimeters and is living with HIV. Swelling of both feet. their growth curve falls below the lowest standard line on their growth chart. A sudden drop on their growth curve, continuous slowing of growth, not able to feed or drink. If you see any of these, refer the child urgently to a health facility for treatment. It may be dangerous for the child to start feeding more at home, as this could lead to severe electrolyte shifts. They will need to be assessed at the health facility for the underlying causes of the malnutrition and how to best treat it. For a reminder of the signs and symptoms of malnutrition and what to do next, have a look at the job aid.